Which of the following is considered the gold standard test for evaluating excessive daytime sleepiness? Options are A. Epworth sleepiness scale, B. Multiple latency test, C. Polysomnography, D. Maintenance of wakefulness test. Answer of this question is multiple sleep latency test. MSLT is the gold standard for objective measurement of daytime sleepiness. It measures how quickly a person falls asleep in during quiet environment during the day. It is especially used in narcolepsy and idiopathic hypersomnia. Which of the following parameter is not directly measured during an MSLT? Options are A. EEG, B. EOG, C. EMG, D. Oxygen saturation. Answer of this question is oxygen saturation. MSLT measures brain activity, eye movements, and muscle tone, not oxygen saturation, which is part of overnight PSG, polysomnography, not a part of the multiple sleep latency test. Excessive daytime sleepiness, EDS. Excessive daytime sleepiness is subjective symptom characterized by an increased tendency to fall asleep during normal waking hours. It is a marker of several sleep disorders and may affect up to 12% of the general population. Commonly associated diseases are snoring, obstructive sleep apnea, obesity, diabetes mellitus, renal failure, uremia, narcolepsy, and restless leg syndrome. Assessment tools. First tool is Epworth Sleepiness Scale. It is a simple self-administered questionnaire assessing the likelihood of dozing in 8 different situations. Each item scored 0 means no chance of dozing and 3 means high chance of dozing. Maximum total will be 24. If this indicate more than 10, it is clinically significant. This guy having EDS means excessive daytime sleepiness. This Epworth sleepiness scale tell us how likely are you to doze off or fall asleep in following situation. In contrast to feeling just tired, this refers to your usual way of recent time. Even if you have not done some of these things recently, try to work out how they would have affected you. Use the following scale to choose the most appropriate number of each situation. 0 means no chance of dozing, 3 means high chance of dozing. So, situations are first situation is sitting and reading, second situation is watching TV, third situation sitting in inactive in public place, fourth situation as a passenger in car without a break. Fifth situation you are lying in rest to in the afternoon. Sixth situation sitting and talking to someone. Seventh situation sitting quietly after lunch without alcohol. And last eighth situation is in a car while stopped for a few minutes in traffic. Second test for excessive daytime sleep is the multiple sleep latency test, MSLT. It is a objective test using EEG to measure how quickly a person falls asleep during several daytime snaps. Measures sleep latency, time to sleep onset. Sleep latency if it is less than 8 minutes, that consistent with the pathological sleepiness that can diagnose narcolepsy or idiopathic hypersomnia. Third test is the maintenance of wakefulness test, MWT. It assesses ability to stay awake in a quiet environment. Latency less than 20 minutes indicate reduced alertness. Useful for this test to evaluate the treatment of the fitness for working and driving. Additional assessment tool may be like sleep diaries that confirm adequate sleep opportunity, psychomotor vigilance test that measures reaction time and alertness, oscillar test that measures sleep resistance under monotonous condition. So we can assess this additional test also. So most common you can do this sleep diaries. You can keep diaries about adequate sleep opportunities. Clinical importance of excessive daytime sleepiness. EDS increase risk of road traffic accidents, poor academic or work performance. It lead to depression and cardiovascular morbidity. Management of EDS include first identify and treat underlying cause like sleep apnea, narcolepsy, DAM, hypertension and other medications. Second, improve sleep hygiene. Third one is behavioral therapy. You have to give regular sleep wake cycle therapy. Fourth is pharmacotherapy. If needed, you can add modafinil, methylphenidate, or other stimulants. Fifth is lifestyle modification. You have to reduce the weight and avoid alcohol and any sedative. Key cutoff summary are ESS detect the subjective sleepiness. If this is more than 10, it's significant the EDS. MSLT, multiple sleep latency test. Sleep onset time is less than 8 minutes. It detects the pathological EDS. MWT, maintenance wakeful test. It detects the ability to stay awake. If it is less than 20 minutes, that means there is reduction of the alertness. So this is all about excessive daytime sleep.